Madam MC and Mr. MC. Good evening to you all once again, and I want to again welcome everyone here to this lovely program that has been organized by the church. I know that it's part of the family enrichment things that we do for the health and the benefits of the family. So we thank the church for always being mindful not of the spiritual things, but then also of the physical things. And so, Doctor, thank you for honoring our invitation, and a very big welcome to you.
Thank you very much. I'm glad to be here.
Okay, so to kickstart, today we are going to talk about the benefits and then the causes, symptoms of some family health diseases that are chronic and that are reoccurring in our society these days, because we've realized that these days a lot of families are busy, parents are busy. We have working mothers, fathers, always running up and down. So it has become very prevalent that people just some don't have the time to cater for the family as we ought to. So these diseases, we are hearing more of it. So that is why we have invited you here. So to kickstart, I want to invite you, I want to ask that what are chronic diseases and why are they becoming more prevalent in the families?
Okay, thank you very much. I just want to start off by saying I'm really grateful to the church leadership for this program, for thinking to invite me. I'm excited to be here. From my very short work experience, Dr. Fosu is here. He's way senior to me, but in my very short 2 years of work, I've seen so many people sick of these very chronic illnesses, and it was tugging at my heart. It bothered me because people were losing their parents, losing siblings, losing relatives at very young ages of diseases that are preventable if only we have the knowledge. So it was really on my heart to spread awareness on this. So I'm very glad to be here. Now to what chronic diseases are. They are diseases that start slowly. Chronic means long. So they are diseases that take a long time to show themselves or reveal themselves. So we say they start gradually or slowly. So it takes sometimes 10 to 15 years before fully manifest symptoms versus acute problems where those show up in very short period, like malaria or cholera. Those you show symptoms very quickly. But chronic diseases, they go on for a long time, often without symptoms, which is why they are so dangerous.
Thank you very much. So can you give us some examples of the chronic diseases?
So chronic diseases are also known as non-communicable diseases. Non-communicable means that you can't pass it on from one person to another by touching or coughing or through the air, versus communicable diseases that are diseases that are passed on either through a vector, like an organism or an animal, or through the air or handshake, like COVID or malaria by a mosquito. Those are communicable. But non-communicable, you can't get it by sleeping with somebody or beside somebody or hugging them or touching them. So they are also, chronic diseases are also known as non-communicable diseases, and they are also known as lifestyle diseases. We'll get to that, but they are known as that because our lifestyles are what bring about such diseases. So they include hypertension, which we've all probably heard about, diabetes, chronic kidney disease, chronic respiratory diseases, cancer. All of those constitute chronic diseases because they take a long time to develop fully.
So with the chronic diseases like hypertension, diabetes, are there specific age groups that it affects in families?
Okay, so there are specific age groups. For hypertension, there are two types. The one most of us know about are what plague older people. They often affect older people, but now we are beginning to see them in younger people. But hypertension can also happen in younger people, which is also an awareness we want to make known, because people think, oh, I'm young, so I'm surely fine. But hypertension can happen in young people as well. So for now, because of technology and how the world is going, we are seeing most of these diseases now in younger people, while in the past it used to be in older people, say after 40. Now you can see hypertension or diabetes in people younger than that. So while it typically is in older people, younger people can also have them.
Okay, so has there been a research? I don't know about it, but then has there been a research to prove why these days it is found in that is hypertension, it is found in why it is found in the younger people?
So it's a combination of factors, and most of it boils down to lifestyle again, because in the past there wasn't so much technology. People walked everywhere. People ate what they grew. Like our grandparents had farms. They ate straight from the ground. But now there's fast food. There are so many cars. There's trains. There's lifts. So basically, no more exercise. We are eating unhealthy. There's so much stress because everyone has to hustle to make money. So all of that is compounding and adding risk factors to our lives, which is what is increasing the incidence in our world today.
Okay, so with the food, you mentioned about food. Currently, we all are witnesses of the lifestyle. Like we have. Okay, so we'll be mixing it with a bit of Chi and then English. Tisisiano, there are lots of fast food. Baby or befabiano. Is it a main course and are there other courses apart from Sabia or being exercise, say, or be any area nepa? Sometimes if you crana the better not the already prepared food, but then if you have foodstuffs now also no. Has there been a research or is there a linkage to it causing hypertension, diabetes, or obesity?
Okay. Means me more research no film straight, but say na make no. Yeah, yes, is no. Technology na kɔ n'anim paa nti nneɛma bebree abɛka yɛn ho a ɛboa yɛ kakra ɛna ɛnsa nso mmoa yɛ kakra te sɛ yɛn mu bebree sisi a yɛn mu bebree etwi kaa yɛn mu bebree yɛn nya time ɛnnua yɛn yɛduane nti yɛtɔ nea ɔmo tɔn wɔ kwan ne so ɛno nso deɛ ɛyɛ obi business ɔnhyɛ da fa nutritious things ɛngu mu because or try sɛ ɔbɛnya ne sika nti saa nnuane wei nyinaa yɛdi like kelewele ebi ɔbɛkye anwa no saa by the time wodi na wakye no bɛyɛ sɛ 5 times all of that increase risk of getting some of these diseases because anka ideally no ɛwɔ sɛ wo use one or like 1 or 2 times ana ebia foodstuffs no all use the fresh one to say wo anka wo nua oduane wo fie no wo be use nutrition wo mu it is our contributing factors when nyina ka ho say obi ko adwuma o medu fie ntem nti ontumi nya time enua ne duane na wato kwan so de so enyama bebree abeka ye life nso sia na high nisa nyare ho.
Okay, inti are there some maybe I will see it me ye I be boy and said there are chronic diseases that will not get it.
Okay. Maminka winka ho say enye lifestyles no kwa sometimes to genetic components be ka ho because sometimes we busemu pressure wo mu ana BP wo mu now so wo the bad lifestyle na ka ho wo worsen wo plight because sometimes so pressure will boost more. Now with the bad lifestyle you are increasing the age at which will be demonstrated chronic illnesses way. And see also another factor genetics. Any age as we age more the body is deteriorating naturally. That's how God made it because we are heading towards the end. But with these factors we lifestyle way age genetics now we're simplified so sometimes it will boost no want to mean anything about genetics but ya obe tumi aye bibia fa ho ne wo lifestyle enuane a wodi say obe nante and say obe di obe home sometimes obe take leave the leave no e wo ho sen obe home but obi be ka say dey bi o say minya sika ti na wa leave ni mu nyina na o ye djuma obe nya sika no de enso wapomuden better somewhere along the line.
Me per se, want us to talk about obesity too because I heard, and I don't know when our doctor until said sometimes obi wɔ hɔ koraa a ɔnyɛ kɛseɛ bebree, but the person is obese. So give us a little education about obesity.
Okay, so obesity mostly relates to BMI, which is body mass index. That's calculated by your weight over your height squared. A BMI of more than 30 is said to be overweight or obese. But there are people, it's not that every big person are the only unhealthy people. There are slim people who are also unhealthy, like me. So it's not that because I'm not saying I'm unhealthy, but you can be slim like me and still be unhealthy. Because fat na it's not just the fat that is visible to the eye, but the fat around the body organs, which slim people can have. So right now, like me, I don't look like I'm fat, but maybe there's a lot of fat around my heart or my liver, which is dangerous. That's the fat that is more dangerous. So they can actually be somebody who is bigger or appears fat, but it's actually healthier than someone who is slim. And that's a misconception a lot of people have, that slim people are automatically healthy, which is not true. A better indicator of body fat is a waist to hip ratio, which is basically like your waist measurements, what you take as a simplest over your hip. That ratio is a better indicator than BMI normally, but mostly BMI is easier for everyone to do. So typically we use BMI. So normal BMI is between 20 to 25. Less than 18 is underweight, which I am, unfortunately, but I've been trying. So the goal is to remain in normal BMI, but also keep in mind that what is important is the fat around your organs and not necessarily what is outside. Who can appear big but are actually healthier than somebody who's slim looking.
Thank you very much. E.T., you made mention of waist over hip. I think that one will be easier for a man because a farmer dear party. If you can explain it just a little, say the seamstress, the person can ask and then do that calculation because BMI maybe I say we check a
BMI is actually also not hard because Obia Ghana card you measure your height. Me, that's the height I've kept in my head, that is can you always check your weight. But unfortunately the waist to hip ratio, I don't have the measurements of head right now, but I know that that's a better indicator of inside of body fat internally, visceral fat, than BMI. But I'll get that information to you when I do.
Thank you. And then let's also talk about a bit about diabetes. Arabia, I said, but we know that it has severe impact on our health. So educate us again about diabetes. The kind of diabetes and what Brain said. Is it family, like genetics?
Papa, my consultation, my OPD say every day, anya cases are measured by pressure, diabetes. Now, you can say situation area a trace basically simply say situation na wo moja no e wo so. Na adenti na akosho. Normally your body produce hormone via a friend of insulin. There was a insulin to me regulate sugar level. But in some people, no insulin is shared and you must say, because of a variety of reasons. Most of the chronic illnesses, normal risk factors, age and then genetics. But with the lifestyle problems, are worse. So some people again will so you are at a higher risk. It is uncle for now will boost your more. So we'll see what team say. I did will make boost your into won't find lifestyle choices at a diabetes now revealing it. Now you can say it was sure values pain you can sugar no cry can once a year or two values. Uber hospital be almost check it or say either FBS or RBS. FBS is fasting blood sugar. Sugar level over the last 8 hours. So say from the time you slept to the morning, over hospital fresh now when the answer now over now sugar normal check me fasting blood sugar. Ideally in a normal person I would say a year less than 7. So where did it the sugar, we call it the random blood sugar, and also normal level is less than 11.1. It is if you are above any of these values, then we say that oh, and diabetes. Some of the symptoms are with me now, something that can also go for something else. But I would also be especially and also more than 3-4 times it's a symptom. And to come to every day we are feeling thirsty out of the normal. And who lose weight, I won't share that. Like who did it normally you are even eating more but still also take those can be signs. But sometimes too, most of these don't happen or being final being shed down because so the obedience say oh may no must be doing but now we na sugar and a wash who do very critical levels perform to me hospital with sugar in the 30s or 20 now I know there it's like I shut it down the body so I mean the basa basa we hospital near check here near wash those are some of the symptoms.
In Chino, your camera is is it because is it related to maybe taking sweets and I say there are other causes?
This is a very common misconception. Say eating literal sugar may cause diabetes, but no fine. Most of the food that you eat, get a digest here is turned into glucose, which is sugar. So it's not sugar to say like citria water, but most of the carbohydrates get converted into glucose. And then mostly carbohydrates, food, banku, carbohydrates, the better digestive, and then than sugar. And then so yes, and exercise, everything. What did they win? No matter that all that sugar is just in your blood because you are not using it. In the end, the excess glucose gets converted to fat as well. So when you are eating a lot, so it's not necessarily sugar, not 80, but in your near yeah, most of the time in the balance, most of it is heavily carbohydrate. Digestive, you are not done in glucose. Say, yeah, exercise, yeah, burning glucose now. Some of the glucose tends to fat, which is why you get bigger over time. That fat, and so we're seeing insulin medicine. So that's how it compounds. Now, abu situation.
So we talked about hypertension, diabetes, and chino. As I really so we say no. Dear Nat, if you made mention of food, so what are the times that you should be eating some of the foods that will help us? Because if you are still food because we need to go and about food, it's okay than rice. So my typical in a typical day, maybe I'm not obedi way, a real obedi way, how should it be? Say a because I also realize that no most people do it is good to exercise, but sometimes you know maybe once a week family exercise, but I also believe say yeah, they are in between maybe I want to know what are the lifestyle changes that we have to continue putting in our way. All this year, so I'm not so.
So the basic one is say you be a balanced diet. Again, a balanced diet more. Carbohydrates kakra, protein kakra, fruits kakra, vegetables kakra, fats kakra. The basics any no. But there are certain foods that the ABA will be bebano and one on to me say only. Ideally, say the aduane tena yam like 3 to 4 hours. So you have to keep that in mind. Anytime I would the best 7 aduane ne bet now for 3 to 4 hours by 11. That's our time water. So all of that when it digests will just be sugar in your blood while you are asleep. And that's what will be compounding to end up giving you the diabetes. So in the end, no, it's just a balance of having every part of the food group so maybe I will get all the necessary nutrients. Another thing, let's say low salt diet. Adia a western pressure pan in China. You know, be even near the in China sans table, so I would be all of that is western pressure because salt no increase blood pressure. Research actually say reducing salt content alone can reduce blood pressure by itself without even any medication. It's so yeah, another another contribution.
Okay, as Madam MC Kasami, she made mention of stroke. I think that will be the last topic I want you to address as well. Personally, the Huno Obia, I don't know, say they stroke, but then the person was just walking, the person fell or caught within some seconds. Ebia, their first aids up, it was here to me because very sad sometimes. Obi, when you meet a situation like that, is there something that we can do? And what are the early symptoms? I was say, yeah, share with the stroke.
It's stroke usually a result from high blood pressure. And you said that's the only cause, but mostly nani pano or pressure, but no only. Because another thing they say, your fair hypertension, the silent killer, because a mouse symptoms be a won't feel any type of way. Nyamia don't wanna what it me tea me ya and me home shed down for me. But most of the time, won't feel any symptom. Most of the medical outreaches are ya or has say nkofo bi ninam ebi oton wade na ojae obe fa ho BP 200 over something. But no ninam oton na de o hwe nye no wose o omo yes skin ma member fa ho obekwa kwhwe ne BP na 200. It's na most people around. It's most of that story of oh no nanti no talk from some of it is stroke and then it can also be heart attack, which is also from pressure. And pressure no the consequence, the complications they do also be a lot of the problems other chronic illnesses if we these two major ones pressure and situation and stroke a bit me heart attack and a kidney problem. It's na say to me control these two very well. We'll be able to reduce the incidence of the other ones. Now we'll how we can prevent it or face it. The prevention I'll be me and say we check your pressure occasionally because we won't feel anything I be or say mama go hospital go check it. And he say the only time I'll be check your pressure is Waba hospital. Say see a pharmacy squad check it for free. So you can just walk into a pharmacy and just say me check my pressure at least once or twice in a year. Say we need pressure anyway so. But say pressure also there you should be doing it often. Another misconception is say one more way drone so. O don't to a drone so pet na jai pressure and check because my drain may fight drew I'll be fine. But sometimes maybe you start with 10 milligrams. Ube drew with him not 10 milligrams in control pressure biome. But if any drain say, oh, maybe 5 pressure drew, a son on my hospital no, because pharmacy na go to street. 10 years nina, not 10 milligrams na no that's so. But by the time 10 years now, 10 milligrams is not enough for him. But or drain say, oh, me family pressure drew, or be baby hospital now when you're stroke on TRC. But I was say, who died drone to nina, ni follow up, ni say, is it well controlled, any control, and ye de be a cajon. But a common misconception is, oh, your mammy drew and one no turn on the side because they've also made antihypertensives like non-prescription. Actually, it just say any doctor you don't need a doctor's prescription to buy it because in person will be better say oh mentimi ankoto medro because doctor anyhow. But that's also a disadvantage because of the American because obeka say hospital queue long too much mentimi call many adaje metiase but in the end complications say bit to me see. The best advice is very simple, but we often ignore it. It's just to check the pressure in more than 5 minutes and it can save your life. So that's the first prevention.
Doctor, yeah, that's it. So at this moment, your baby says you'll be a question via or person will be sir doctor. Doctor is here to answer your question. But the doctor would like you to summarize everything that you have said about the lifestyles, diabetes, obesity, hypertension. In summary, what would you tell us?
Okay, my presentation kakwabi to run through just to give us an idea of that. It is me share no chronic diseases in yarewa e share slowly in kete won so edi a lot of years like 10 to 15 years and sana we the effects for our body. Okay, before I start, remember the MC said that I love God. I do. And actually, I hate public speaking. Like, it scares me. But I'm doing this because Senyamika and me 2 years experience me who a lot of death, a lot of sickness anka any ho say wo because this verse I'm hearing in the say everybody pesi yetina apomudemu, but sometimes ye ni nimdie nintino ye hame ya your own body. So this is a verse I really love. It helps me, it reminds me why I do this work, that to help people to live in good health, because that's the will of God for our lives. And another problem I saw while working was is found in Hosea 4 verse 6. For my people are destroyed because of lack of knowledge. And it's a lot in our part of the world. People don't understand the causes of these illnesses. They don't understand their contribution in these illnesses. Obi beka say obi na eye no ana obi na tu nejo, but it's some of the things they are doing. So it's lack of knowledge that's also resulting in some of these illnesses, which is why even though I hate public speaking, and this scares me, I'm still here doing this because I want to help people really walk in the will of God, which is good health. So like I was saying, chronic illnesses are diseases that start slowly and take a long time to progress and reveal themselves. They are also known as lifestyle diseases because they are mostly how we live our life that bring about the illnesses. Also, they are also known as non-communicable diseases. So all of them mean the same thing. Examples to say hypertension, which ye name say pressure and BP. And diabetes, you must be friend situation chronic kidney disease. There was a time in the country there was a lot of fuss and noise about dialysis. It's from chronic kidney disease, which can be a complication of both diabetes and hypertension. Then you also have cancer, which is also a chronic disease because most cancers take a long time before they show themselves. Funny coincidence, just last month was hypertension awareness month. 17th May was World Hypertension Day, and the theme for the session was measure your blood pressure accurately, control it, and live longer, which is the summary of it all. If you know your blood pressure and you are high, then you take your medications, you control it, you live longer. If you don't, then we get the other complications which we all don't want to get. So what is blood pressure at all? Blood pressure is the force of the blood flowing in the arteries. Pressure moja woye intinimu edefa intinimu. Senya how do we express blood pressure? Blood pressure is expressed as a fraction. They be able two values, one over the other. The first one, normal blood pressure is less than the first number is often called the systolic, and it should be often less than 120. Then the lower value is called the diastolic. That should be less than 75. Most of us know 120 over 80 in our head, but recent research has pushed the value lower for normal blood pressure. So now normal blood pressure is less than 120 for the top and less than 75 for the down. Then there's elevated blood pressure. This one, you are not necessarily hypertensive. BP ni so yet, but you are on the way. This is the group of people are almost what's the sound lifestyle. You can go back into the normal without medication. Just on lifestyle changes, you can go back to normal. Then you have the actual hypertension proper, which is 130 to 139 on 80 to 89. That's stage 1. Then the stage 2 is greater than or equal to 140 over 90. The value most of us know is the 140 over 91. But the 130 over 130 to 139, 80 to 89 is also the early stages where lifestyle modification will also greatly help, even without medication. But when you get to more than 140, 90, then you are increasing your risk for all the other complications we want to avoid. Next slide, please. Okay, and then diabetes. So diabetes is basically, like I was saying, a condition in which your blood sugar is high. Situation na wo moja no e wo so adenti na e wo so because senya make no yedidi a your body ni produce hormone bi e fe no insulin eno na e push situation no into the cells na blood sugar na go back to normal. But in some people, either say omo produce insulin no and I say omo produce insulin no kwa and sheda ni dwuma se na e wo say diabetes there were two types, type 1 and type 2. Type 2 nkrofo there for some reason almost to me produce insulin, and those people, that type of diabetes is normally in younger people, and is is because their body cannot produce the insulin as it should. But near you who commonly obia is the type 2, which often happens in the older people. And no, almost still produces some insulin, but the insulin need to mean yejuma or nipejan senya was say. So the diabetes who most of the time a type 2 one, but there's also type 1. And no, it's often younger people too, who will be like 20 something or diabetes. Normally it's not the type 2. But in I will make an alien so yeah, lifestyle my type 2 were very young people, like teenagers, especially if you are obese, because obesity increases the insulin resistance and then brings about the diabetes. So even though type 2 is normally the type in the older people, we are also beginning to see it in younger people because of, again, the lifestyle. And figures now may boy in the beginning, normal fasting blood sugar, say in 8 hours or more, less than 7. And so we did your blood sugar should be less than 11.1. More than these values, now or any of these symptoms, we Johnson 10 and I do Johnson baby, and now Johnson I don't no dorsal, no monsieur baby, who did baby, so we sorte all of these symptoms. Now sugar above any of these values, you are probably diabetic. And cancer, they spend a lot of time on it because it's a very broad topic. But basically, it's abnormal growth of cells in the body. And if you think about any part of the human body, cancer can affect it. Just name it, you can have cancer there. But no, this is a fan of 111. It's no, but some of the things we are also doing also brings about cancer. So cancer is also a chronic illness. Okay, see, lifestyle being na in your way at the brain. Lifestyle senya bravo, your way of life, your way of doing things. So it includes the things you eat, the your activity level, your stress level, the things you drink. So what are the lifestyle things that in your way a brain? Senya mekain no unbalanced diet. More carbohydrate based diet than a balanced diet, no fruits and vegetables in the diet, high salt intake, high fat intake, all of that increase your risk. And a sedentary lifestyle, say won't a lot of exercise. They be able to baby faco. Your job requires you to sit in the same seat for 6-10 hours continuous. We are wasantina left aquaform. We are wasantina ukamwetri. So there's basically no activity in your life. It's not really being bent, it's just being stored as fat. Now we increase your risk. Then obesity. So that's also resulting from an unbalanced diet and then low activity. Then you end up in obesity or overweight. Then alcohol intake. This one is very controversial, but we are in church, so we all know pastors take on alcohol. No alcohol at all. But one more though deliberate. You say that we'll reduce alcohol intake, but we'll avoid there. It will be way better for us. And then smoking. So cigarette smoking, marijuana smoking. Now there are a lot of things that are smoked. All the kinds of smoking is bad for our health. Then illicit drug use. So like cocaine. Now there's a new drug in town named Red. All of that doesn't help our health. Then stress. This is very important in our day because obia hustle, obia pesca, which is important, but it was say home balance no. A do time as obenya liver, for live no na home. And in my world, dear friend doing something called locum. What live ni na wo san ye juma, obe locum ne we na wo san resume other job into like no rest. In the end, you make the money by 40, but obe na fe wo they turn do. So did you really help yourself? Do you see? So stress is also another factor in our lifestyle. So how can we correct it? Basically, by doing the opposite of all the things I said. So instead of unbalanced diet, let it be balanced. A little fruit, a little vegetables. Or because say, I also used to say the same thing. I don't like pear, I don't like mango, but I've decided that once a week, because you need to recover. So I've also decided that I don't like pear, but it's healthy. I'll close my mind and my eyes and eat it and just get the nutrients. So that's sometimes how we have to think of it. And because when the leaves, too many leaves, will be plenty greens. But in the end, it's for your own health. Say yare ni your mom will draw said because so that's how we have to think about our diet and then eat balanced ones so that it will help us. Then exercise, so activity. I'm not saying don't drive car anymore, but if there's stairs in your workplace, instead of using the lifts, then you use stairs, then small exercise. Then stop alcohol intake at all. As ICGC members, the hours has to be stopped. The non-believers, they'll do limits, but we have to stop completely. Then we also quit smoking. And for those seeking to reduce their weight, target BMI should be 20 to 25. Okay. Then she say one treaty hypertension and one treaty diabetes, I DNA basis, stroke, stroke, heart attack, kidney disease, heart failure, retinopathy, pressure situation how we need the small blood vessels in there until be home with time to me that's what retinopathy is, and the two of them cause retinopathy. In fact, the first two can cause a lot of all of this. So that's why I said that if we control those ones, we will be able to control a lot of the other complications like the ones here. And then the last one is death. Some people are fortunate. Obi stroke or best survivors sometimes without any paralysis. Obi goes from straight into stroke death, like there's no middle, and you can't predict. People have had stroke at less BP value. Say I'm kind obi to me and I'm with 200 over 10, 100. Obi beba with 150 over 96 or 150 over 100, and that person has stroke. Like you can't predict who will get stroke at what blood pressure. So to me, can say you are safe. People have had stroke at way lower BPs, while people with 200 are on the street. So the safe thing is to just check your blood pressure, check your blood sugar. They don't cost much. I think sugar almost check here is 10 cedis. Blood pressure is free, but you can save yourself a lot of stress and a lot of these complications when we pay more attention to our health and then our lifestyle. Thank you.
Dr. Belinda, yeah, that's the show. Pacho obi wo ha or question be I address be our has saying Pacho bits me a mouse so that. Okay, doctor. Pacho be who say machine BC name. Can you describe what it is, what it does for us? Thank you.
Okay, so this is you move a friend BP machine, but the technical name is a sphygmomanometer. It's too long to be saying this, so we mostly shorten it as SPHIG or BP machine, but then the actual name is a sphygmomanometer. So this is the digital type, or the manual type, and on the ube pump, but this is easier for everyone to use it here. And ube demonstrating how to take blood pressure. Into may here volunteer.
So your boy is my mommy.
Okay. So, relax. So before you check blood pressure, the patient should be at rest, relaxed. Most of the time, on Beba Hospital, normal and check it. They've just done activity, it will be high. Or some relaxing nicely, give them like 5 minutes to rest. So, machine in it. Read the Beba Hase. And I afraid this one, the cuff. The way never con in sunny home. Oh, check calf now. This tube, I will say the inside part of the arm. And you see, I will say this one this side because this one actually ebe check pressure. No. So I will say this tube the inner part of the arm. There's another important note about the calf. I also use the right size of the calf. Also, obia basa different. And a calf no you different sizes. Sometimes obia basa o de ade ni sisukwa and to mean because abasa ne so. And me say I may very slim. Would obi a calf size that would be chiche obi and abasa ne so now the chiche me there. Ebe come in san and no checking me pressure is not accurate because our calf size no commencer. So you always have to look at the hand and then they choose the calf size, but we there's appropriate for your volunteer. It's your better so. Another thing is say I will say baby a machine that any ninsano the same level. And an ninsano so I will say at the level of the heart. Then you say like table where case swanka it's not really ideal. I was saying insano at the level of the heart now machine so what the same level with the patient relaxed now feel with me say. You use one BP reading and decide this will be a hypertensive. Sometimes, mommy does. Sometimes, obi beba. Sometimes obi beba hospital no also a pressure ne bed inti all banina no that pressure no because of a huna it can go high. So anxiety. So we don't use only one reading, but we use multiple readings few hours apart. It is say be a hospital na me hu say ya me manako fee now I be a friend no profile. Until what fee no there she's relaxed, nobody's tensioning her. No also check your one up and then we'll see the values what they are. If they are regularly high, you who say just say near hospital nothing or no pressure on the so. But a bit more able but na say obeko fee no it will actually be fine, which means that na a hospital na tension your friend white coat tension. And doctor and white coat never nipa have attention na pressure na kusho. So yes, that's it. So basically we'll check your pressure. Nipa no should be relaxed. The arm should be on the table in the same level as the heart. Use the right calf size. And yes, who deceive you. If you don't use the right calf size, it can give you false hypertension or make you think you are not hypertensive when you are. So the right calf size is also important. Then how you wear the calf. The tube should always be on the inner half of the inner side of the arm. And then you check. Then as I said, more than one BP reading. But if you are already hypertensive, this is a good investment to have at your home so that you yourself can be monitoring your pressure. While a cautious will say, "Oh, to me by hospital, no case, oh, me that do way so me who say we feel my pressure no kwa na cautious. Me who will be or by hospital no because almost sorry pressure machine and they check it for free. So she just went one day, she checked and was high and she just came. And I was so impressed and happy that the church could like help somebody like this because also okay, like I saw pressure checking it no who say was shown our back. So it really impressed me and I was like the church can really help with something like this because Ghana or Africa, we are very spiritual people. Sorry. So imagine that every church has BP machine. Like we can be detecting hypertension way faster than we are now. Because the CRDA is mostly, I just say me yare ansa na ma hospital ni hu say e wo so but senka wa so na upon na wakofa ho a check 11 because be hu say pressure wo mo so way faster. Thank you.
Okay, please, we will take a question from Mommy.
Last month, the last 2 months. One, I think she kind of collapsed, and when they went to the hospital, it came out that high pressure, but then it affected her mind. Then the second one, he is a man. He was already on BP medicine, but we understand that I think the medicine got finished for 3 days or 1 week. He was not taking it. Then his own, it affected the speech. He cannot talk. So what my question is, when before those things happen, do you always get the sign? Like I said earlier, the man from the church, at least he was saying he was getting some signs. But in my relative's case, one, the way the mind is, so you can't even find out, oh, what happened? Were you feeling anything before then? The other one too cannot talk. So what my question is, our culture here, just as you said, unless you are sick, you don't go to the hospital. We are trying to change that culture by this program. But are there sometimes that if you are feeling this thing, even though you are not down, but that should be a sign for you to go to the hospital immediately? Thank you.
Thank you for the question. Like I was saying, most stroke is caused by hypertension. And we call hypertension the silent killer because it gives no symptoms. The worst symptom or the most common symptom people with hypertension feel is a severe headache or just a general unwellness. But somebody can assume it's malaria or I'm tired. So it doesn't really occur to people that it's probably hypertension, especially if the person didn't even know they were hypertensive in the first place. Obi no onim say pressure on the so. But last 3 days, me hoye me basa na me tipa me samba. Obefa say oh edwuma na wa ya na stress. So that's the most symptom. When stroke is big, stroke too is so varied. There are 2 types. One is a blockage of the blood vessels in the brain, and one is rupture. The one which is often rupture is very sudden because it's like the pressure is so high that the blood vessels just burst like a balloon. And that one, it gives more severe complications because imagine the brain, like the skull is not expandable, it's bone. Then you are bleeding into the brain, it's not going anywhere. So that one, mostly, there's no warning symptom. It's just bad headache and then collapse. So they can't really tell you much. The other type is when there's blockage to the blood vessels. Now, the brain controls a lot of the things we do. There's a part for speaking, part for walking, part for this arm. So depending on what part of the brain that the blood vessel to is blocked, that's the symptom you get for stroke. So be a stroke a difference. Obi no sapena ajojo and an pena ajojo and obi the kasan like what you are saying. That means that the area of the brain that there's no blood flow to anymore is the part that controls speech. So obia stroke is different. Sometimes it shall say as obe feel say unknown nature and our kasa is not really coming out well, it's slurring. That's like how he feel like it's beginning. In advanced countries or abuche fono, omo edrua it shall say yeah like as a kasa name by or feeding weakness in the arm or do hospital. If you reach within 4 hours, they can give you a drug that will melt the clot that is blocking that part of the brain. But we are not yet most people, by the time they'll come, it's been more than the 4 hours. And even that drug is so expensive. So again, the way we can prevent it is by controlling the blood pressure, because we are not yet advanced to the level where people can even get to the hospital fast enough within 4 hours for us to give that medication, or people can afford that medication to dissolve the clot. So mostly the symptom is weakness, but by the time you are feeling the weakness, the blockage is already happening. So we are mostly late. So how we can prevent it is, again, checking the blood pressure, changing our lifestyles. Thank you.
If I should be or hobby or question. Okay, maybe I should be me about him.
Okay, very good question. So there's hypertension that is pregnancy related. We call it pregnancy induced or gestational. Sometimes after the pregnancy, it resolves by itself, but sometimes it continues, like you are saying. There's not really a risk factor for gestational hypertension per se. Sometimes, again, already the hypertension is in your family, so you're already at risk. Pregnancy too, some of the hormones affect the blood pressure, increase it. So if your hypertension is in your family already, you're already at risk. Then pregnancy also comes to add the hormones to it, which affect the blood pressure as well. Then you end up getting it. But sometimes it resolves after the pregnancy, and then there's no problem. But then you can also have it in the next pregnancy. So maybe the first pregnancy you have it, it resolves. The second one it to come in. Sometimes it stays after. So another problem with this is mostly after the women give birth and they close the postnatal, there will be no follow-up again. Maybe during the postnatal period, it was looking like it was resolving, but you see months after or years after, then full-on hypertension has happened. But the person doesn't know, because he thought that hypertension was just related to the pregnancy, but it was the premonition of it actually coming on. So my advice is, if you get gestational hypertension, to be following up the pressure more frequently. Don't forget about it just because the pregnancy is over. Having gestational hypertension is a risk that you develop full-on hypertension later in life. Thank you.
Thank you. Thank you. Okay, please come forward.
The BP values. I know that I want to give me a chart. The older you are getting, it's becoming higher. So is it the figure you mentioned for between older people, or there's a range that we have to, because I know that the older ones, they are a little bit higher than the younger ones. So I can explain that one too.
Thank you very much. That's a good question. So this is just in general terms, and this is to be able to get those in the pre-hypertension stage to be more aware. But like you are saying, as you get older, the blood pressure gets higher. So these are not the same reference ranges we use for older people. Older people, around the 140/90 is not considered terribly high, like if a younger person was having that blood pressure. Also, if we put you on medication, we have targets for the measurement. We are not trying to get it as low as the less than 120 just because that's normal blood pressure. Because like you're saying, as you get older, the body is just naturally degenerating. So you are right. For older people, the references are not what I said, but I stated these ones just so that younger people can be more conscious of their blood pressure and be aware. But for older people, beyond 60 especially, 140/90 is not considered terribly high. But less than 50, less than 40. Ideally, it should be less than 140/90.
Please, are there any other questions? But should be a question. Okay, then I have a question, especially it's related to the men. Because Yati Bebre said taking their BP medication. Obiaka question, Mame. How true is this?
That's a very good question. It's one of the obstacles to taking medications in our part of the world. Because it is true that there are some side effects, but as with any drug, there are side effects. Some of the side effects of the antihypertensives include erectile dysfunction. So it can happen, but it's not in everybody. So if it does happen to you, you can come to the hospital. Either we adjust the medication you're on or give you a medication to support the function so that you can continue healthy and continue the work you are doing. But seeing that but risking your life just to keep doing the work when it can ultimately kill you, I don't think is wise, because there are so many groups of antihypertensives and it's not all of them that cause erectile dysfunction. So if you have a side effect, as with any drug, you just report to your doctor. Then we'll find a way around it. Either we give you medications to correct the erectile dysfunction while you stay on that one, if you necessarily have to be on that one, or we switch the medication entirely. But mostly you just use your own discretion in the house to stop the medication. And actually, stopping the medication and continuing that work, the work is intense and it's aggressive. And even in the act of doing that, you can kill yourself because you are raising your blood pressure doing that activity. So if you have any side effect, if the erectile dysfunction is a problem, just report to your doctor and express your concerns. Not everybody shows the erectile dysfunction. Some people are on that same medication, they don't have that side effect. Drugs react to everybody differently because we are all different in some way. So if you have any side effects with any drug, not even just the antihypertensive, just report to your doctor and do correct it.
Wow, thank you very much, Dr. Belinda. Me did say you BB and Obia at least one or two BD. You know that you are at fault. We are at fault about your lifestyle, and I believe that we'll go out, spread the word, say we should change our lifestyle no matter how busy we are. From what doctor is saying, one, check your BP regularly, because the boy diabetes no or call pharmacy card, they'll be able to check your sugar level in the blood. Also obesity no workouts, share hypertension diabetic level it would reduce. And see, on this note, I would like to thank you so much. Thank you so much, because what share your baby and teacher boy tomorrow you do baby you be near the abobra. God bless you for honoring our invitation.
Thank you so much. I just want to add something briefly. There are these peddlers in the cars or on radio that you hear a lot. A draw way to me nane say a big cure hypertension in 1 month and all those things. It's not true. I'm not against herbal medication because most of the drugs we use are actually from nature, but those are tested. There's research proving we can say what side effects you get. But the problem with these herbal medications, it's not tested, it's not approved. You don't know what side effects you are getting from it. There may be some truth that it does reduce the blood pressure, but at what cost? The kidneys are the organs that remove all the waste in every drug we take. And because these are not tested, we don't know their effects on the kidneys. You may be in some way reducing the pressure, but also adding another disease in the end. I've seen someone, they recommended a medication to him. He listened to people's recommendation or testimony and then went to follow herbal, and then now in addition to the hypertension now has kidney disease. Already hypertension puts your kidneys at risk, then you add herbal medications that are untested, you are increasing your risk for more complications later in life. So let's be wise, let's be circumspect. being Christian does not mean you don't have to take medications. You can believe in God and you can still take the medication. You can pray and you can still take pills. God works through different ways. So it's not that we believe in God. So yeah, Fedro, you be Fedro, near Bompai. Yeah. Gina made for healing. Thank you very much for having me.
God bless you.
We are supposed to be ending the questions, but we have a special person with a special question here. So.
I thought she was just going to. Okay, so look, this one, quickly, just to confirm, there is this perception. I don't know how true it is that there are some medications that are likely to trigger, sugar spikes. Is it true? Just want to, get some clarity on that.
It is true. So there's something we call secondary diabetes, which means that you don't actually have diabetes, but some other condition is causing you to have diabetes, and drugs form a part of that. Drugs like steroids, and sometimes that drug is used to treat another condition. So because you are on that drug, you have diabetes, but immediately you stop, your blood sugar should return to normal. So there are drugs like that. But since it will be most likely prescribed by a doctor, the doctor will be monitoring that whilst you are also on that